Okay, hello everybody. Everybody can hear us. So, hello everybody and welcome to our first webinar about the future of health in the digital era. And until everyone joins, we're still starting, so allow me to quickly introduce myself. I'm Mohammed Diab, and I'm going to be managing and coordinating this session with amazing people who are coming from a multinational background of different areas. We have practitioners, we have some academics, and we also have some people representing the pharmaceutical companies. So I'm Mohammed Diab. I'm the founder and managing director of Ebers, and I'll be sharing a very, very quick brief about Ebers, which is a digital health solutions company. We provide digital solutions for all the stakeholders in the medical field. We work with pharmaceutical companies, with patients, with practitioners, and we provide them with different medical communications tools. And also, this is our first session of many or a series of webinars about digital health, where we will be inviting multinational experts in their field to talk about different areas of artificial intelligence and machine learning, virtual and augmented reality, and how is that being used not only for training and education, but also for the pain management and enhancing the lives of the patients. And also the electronic medical records, because once we hear about the digital health, the first thing that pops up to our mind is the electronic medical records, but actually digital health has more and more to do, more than the EMRs, using the blockchain technology, for instance, to encrypt the patient data, which is a revolutionizing technology, as well as 3D bioprinting and so many other stuff that you can just sign up to our Google form, and we will follow up with the next series of webinars. Okay. I guess now we can start. So let me welcome our panelists for today. We have Professora Veronica Garcia, which is a physical therapist with 2 masters in neuroscience and neurological rehabilitation. And interestingly, her PhD is about the role of augmented reality technology in neurorehabilitation. She also has an extensive experience working with neurological patients of different pathologies, such as strokes, Parkinson, traumatic brain injuries. However, most of her work was with multiple sclerosis patients, and that was the focus and the scope of her research, which was mainly studying the efficacy of different exercises using augmented reality technology versus conventional therapy, and where she analyzed different parameters in order to measure the improvement in gait, upper limb movements, balance, and also dual tasking. So besides being affiliated with the University of Valencia, she's currently the clinical and scientific affairs manager in Hokoma, Switzerland, which is a medtech company dedicated to the development of robotic devices used for physical therapy of neurological patients. So welcome, Professora.
Thank you so much for the invite.
Thank you. Thank you so much for being here with us today. And also our second panelist would be Dr. Antonio Quintiela. He's a vascular surgeon in Brazil, and he started his career as a resident in the cardiovascular surgery department. And later in 2018, he acquired his master's in medical science. He's a board certified in vascular and endovascular surgery by the Brazilian Society of Angiology and Vascular Surgery. And he's currently the coordinator of vascular surgery and also the coordinator of in Rede Mater de Sud, Brazil. I hope I got that right a little bit. Excuse my Portuguese. So Dr. Antonio is a futurist and passionate about health technology, especially the use of virtual and augmented reality in healthcare services and training. And this eventually led him to start Libby Health, which I'm sure he's going to talk about Libby Health better than me, and introduce the first metaverse-enabled platform for medical education and communications. He's also Brazil chapter president of the VR/AR Association, which is a global association for virtual and augmented reality industry, with over 50 chapters around the world, more than 60,000 registered professionals, and 4,000 companies, brands, and schools. So welcome, Dr. Antonio. It's really nice to have you.
Thank you very much for the invitation. It's an honor to you.
Thank you so much. And our last but not least, our third speaker is going to be Dr. Fadi Emil. He's the cardiometabolic and general medicine franchise marketing lead at Merck, developing markets. His scope includes the whole African continent, except a couple of countries in the North Africa, Algeria, Morocco, Tunisia, and South Africa. For me, that counts as the whole continent. So he's a member of Chief Digital Organization and Regional Digital Committee. He used also to be a former leader of the Digital Transformation Task Force at Merck, as well as facilitating the digital marketing curriculum of CIM Diploma, which is one of the most recognizable institutes that gives this kind of qualification in marketing worldwide. So welcome, Dr. Fadi. It's really nice to have you.
Thanks, Mohammed. Actually, it's my honor as well to join this session. Great session.
Thank you so much. And well, from where we ended, let's start then with Dr. Fadi, where he's going to talk to us about a very, very interesting introduction of digital health and what are the different technologies out there that are transforming the lives of not only the patients and also the healthcare professionals, the way that we communicate together, the way that the healthcare professionals communicate also with the patients. So please, Dr. Fadi.
Thank you, Mohammed. I will be now sharing the screen. Just let me know once you see it.
Great, we can see your screen now.
Moving to good. So, Yani, I would like, of course, to thank Mohammed, and of course, it's a pleasure to be here with Dr. Antonio and Professor Veronica. This is really a kind of interaction about the digital that is very important to be done. Maybe I will take one important point now. This is maybe the reason we are here in this session. Speaking about healthcare is now becoming a part of information technology. Maybe if we go back like 7 years, 8 years, you will find it's a bit difficult. And when we speak about digital, it's about tools rather than strategies, rather than integration even into the health system. Maybe the COVID era since 2020, these 2 years have done a big leap in the transformation of the digital ahead of the future, which now we are speaking about the future of health in the digital era. This made, when we speak about the digital, we speak about how we can make use of the digital technology itself, which comes what is the link? Is it a tool, just a tool that we can use, or we know our pain points and which are the pain points that we have in the health system, and then we can make use of the digital to make the best utilization of it. And you can see here when we are going in the presentation, how digital transformed the future of health and how we already made a leap in the health system. And of course, it will be completed and augmented by the presentations of Professor Veronica and Professor Antonio. This will make it even clear. So as a general, I will be tapping the points about social media and apps, virtual augmented reality, and then moving to artificial intelligence, and finally the gadgets and wearables. Simply, if you think like this years ago, how patients and physicians get the data or awareness about diseases or awareness about epidemics and pandemics. Usually now, I think in the COVID, when all the patients and all the physicians as well were either in hospitals or at homes, the data were easy. You now know the count of patients in each country in no time. There was like a records every day with what's happening worldwide. Previously, this was not the case. Previously, it was just the TV, the ads, and you cannot get this kind of accurate and validated data. But now we are having the social media, we're having the Facebook, Twitter. And even now, when you are speaking about Generation Z, or when you're speaking about even the younger generation, Facebook to them is like an obsolete. They don't use it much as before. So even technology is moving very fast, adapting the generations, the interests of the generations that are there, as well as the physicians and the patients. Because some of the generations of the patients are now younger, so they are using different tools rather than the Facebook, like Pinterest, for example. So this gives us which is the path or which is the channel that physicians or health societies can sell or can promote their messages. It's now becoming which is the channel, which is the media where I can transpond this kind of communication. As well here, for example, like social media awareness, like the Alzheimer disease, like diseases like pre-diabetes, for example, or diseases like thyroid disease or hyperthyroidism. The symptoms are cross-linked with different other diseases. And you will see that the patients are not that aware that I'm having the disease, so I can go and make a checkup with a physician. So now here comes the future of health in this part where you need to know the symptom, you know the disease, how I can link this symptom to the disease, and then I go to the healthcare system in order to get checked and get already the right medication. So this improves the work in patient, in clinics, and in the right places. As well, also regarding the physician, they will get the right patients because they know the symptoms. For example, if you are having an endocrinology part, you will not go to like general medicine or interns. You exactly go to the right specialty. This is the power of the social media. Apps as well. If you remember before, also years ago, and I think Dr. Antonio can relate this regarding the cardiovascular part. It's the heart rate and the cardiovascular system. It's years ago, it's only the palpation in order to get the heart rate. How important now we are getting the heart rate. You see the Fitbit, you see the smart watches, and even you see different wearables and gadgets that are used to know the heart rate. And you know now my heart rate is high, is low. This fits to the health system, and this guides the patient to the physicians to get rightly checked. As well as if we're speaking about the apps and how it made it different for the healthcare system, one of the important pillars of the healthcare system are the pharmacies. Now you see apps that are supporting the patients in the different regions. Now they are making even features like reminders of medications. Patients who cannot move and patients who cannot go directly physically to the pharmacist, they can just take a picture of the prescription because they cannot maybe from the handwriting, of course, or it's difficult. They can take a picture of the prescription and they push it directly to the pharmacist, and then they can get this prescription dispensed. This is how it made it easier. Even pharmacists are now challenging with the apps how I can make a reminder for the patient, how I can improve loyalty of the patient so they can get and it can be easier for them. And then one of the more developed things is the virtual reality. I see also Sarah Veronica may be relating this because one of the great examples it's even when you speak about children, and this is the picture even I chose, which is the vaccination of children. There is a kind of a video, and I encourage you even to search for it, how children can get vaccinated with virtual reality. Now, before it was just the needle, and you get this kind of emotional disruption when the children are getting these vaccines or even the injection. But now, if you put the gadget, if you put the Oculus or the VR device, now you can get like a cartoon experience and just like an action, and then you don't feel the vaccination. It becomes a great experience. This is how even you are improving health into a different era. Even you are giving the patients the easiness of how I can get medication, and you make it an experience. And here I can come back to one point, which is the pain point. From the pain point, you use the digital. You are not just integrating digital just to be using digital. It's you see where is the pain point, you make use of the digital, and this is how we can improve. Then also another more advantages, even it can be seen in the era of the COVID where travel was banned, where a problem in cross-border things. Augmented reality also, which is another advantage, that you can see and interact virtually with the object. In surgeries, it's now using the augmented reality assisted surgeries, it's there where physicians, even with the expertise, can move or act remotely for surgeries using this kind of augmented reality assisted surgeries. So now even the banning in travel, also it can be overcome by the digital era, which already made it facilitated to all the patients and the physicians in parallel. Another layer, which is a more development and advantage of the digital era, is the artificial intelligence. And you can see the different platforms are now using chatbots. Before, when a patient wants to get information, physicians are getting used to texting, to calls. Sometimes the information that are needed are very simple, and this is a kind of wasting of time. But now shifting from this kind of call centers, shifting from this kind of, I can get this easy information from internet or from Google. No, I want it standardized. So healthcare systems, societies, all this made some kind of structured chatbots using all of the common and frequently asked questions in an artificial intelligence chatbots to make it easier for the patients to get more data and to get the information as easy as possible. And these chatbots are evolving based on the new questions that are asked by the patients. You can see this in diabetes and prediabetes, in all the therapeutic areas that are available. And for physicians and patients as well, there is another layer of artificial intelligence, which is the IBM Watson. And I dig actually with the team that made this process. They are coming, if you remember Sherlock Holmes and Watson, it's about how you can get the right diagnosis, just feeding the system with the input, with the symptoms, with all the patient feelings, and also the patient history, and as well the physicians can get this as guidance to get the right diagnosis, because there are lots of diseases that are interlinked totally with each other. So this kind of artificial intelligence make it more easier and make it even the diagnosis taking a different layer and a different era, because now you are not just depending on the local healthcare system that you have, but you can even validate all of this using the global artificial intelligence, which is also evolving directly by time. Maybe finally, it's also a nice thing, and we always use these things like the gadgets, the Apple Watch. It's also evolving. You have seen before like heart rate, and now you can see the ECG using the Apple Watch. The gluten detector that is there as well. The Amazon Echo Dot, which is a kind of artificial intelligence, even evolving. Yani when someone is using it at home, or even now they are promoting it for Alzheimer's disease patients, it can, by voice, it can remember things. It can remind the patients with the time of medication. It can even guide the patients who are not getting clear data to get more data just verbally without even visual things, as well as glucose detection things and different gadgets and wearables that made it easy for the healthcare system. Maybe this is taking all the healthcare system into a different era. The point is how we can utilize the digital era into the healthcare system, fitting the pain points, not just it's only digital. And this is why we can see here medicine in the future will give everyone the ability to become their own best eater. It will be really an asset for the physicians and the patients interlinked together through even different platforms. And thank you. This is my presentation. Thank you for attention.
Thank you so much, Dr. Fedi. It's really an amazing presentation, and I know that within 15 minutes you covered most of the digital health only in 15 minutes. So that's really something. Thank you for this amazing session. I guess we have some questions and answers, and we have like 1 minute maybe to see. Okay. Rania Sulaiman. Okay. She says also about device that measure sugar remotely and do graphs. Yes. So Rania Sulaiman, Dr. Fedi, she's talking about the Abbott device, which is for the continuous glucose monitoring, I guess. So if you would like to.
Yeah, actually, it's true. This now you can see that Apple is taking care of two important diseases. Of course, the heart rate and the ECG, and for diabetes as well, remote monitoring, in order to give alarms for the patient, and even for patients, like if they wear it during time of sleep, usually the attacks or the heart attacks come in the early morning hours. So the watches sometimes measure the heartbeats. If there's something irregular, it makes an alarm in the hand, so the patient wakes up and avoid this kind of attack. The same now they are shifting from the cardio to the diabetes part as well, in order to make it easier, because there was an assumption or simulation of a device or wearable device that can measure blood pressure, heart rate, and glucose level. This is the ultimate they want to reach at the end. But still in the glucose level, they are not reaching accuracy like the heart rate, but I think they are in the process.
Yes, I guess Rania also, she was talking about Abbott device, which is a continuous glucose monitoring as well. Yes, but thank you so much for elaborating more. I guess the gadgets are really revolutionizing the healthcare industry, and I believe that's going to be a very, very big part of the future. So let's keep all the questions and answers for the panel discussion at the end. And now let's move to Dr. Antonio. So Dr. Antonio.
Hello, thank you a lot about the invitation. It's a pleasure to be here and discuss digital health. It's a very important issue, and we think that we have to discuss more and more about it. So let me start, just a minute.
Sure.
Let me think. Can you see my screen?
Yes, perfectly.
Okay, so we'd like to talk about the digital health, and our idea, that's because the metaverse. So thank you a lot. Let's start. So what's the challenge about the health nowadays? For us, the big challenge of healthcare is to deliver this health with quality to everybody, with safety in different locations, with different realities, because the world have different realities, and with appropriate cost. That's very difficult to do all of that with how we used to deliver health in the past. So the digital health brings us a possibility to achieve this goal, because we can do with a lot of tools related with technology that we are using, and Dr. Fed discussed the possibility to deliver health with effectivity, accessibility, safety, and personalization. The World Health Organization understand that and use that with his strategy. So this document published in 2020, I think 2021, put this goal to use the digital health to improve health for everyone, everywhere. So that's what we need to do. But it's not easy. Why that? Because digital health have a lot of benefits. And what is this benefit? The first one for me, it's very important. It's the patient in the center of the care. That's the most important part. The second, it's that we can do the ability to monitor patients remotely. The third part is that we create a lot of data, and this data could support physician and other health profession to make a decision. Another part of this process is when we create virtual encounters between medicals and between patients. That occurs in telemedicine nowadays. Another part is to create interaction between medical and another health profession to discuss cases and other things like that. A big possibility, it's related with education, that a lot of the technologies create something very unique in education, that it's very important to this patient. Like I'm a vascular surgeon, so for me it's very difficult to teach to my fellows some surgeries that it's rare. So this possibility, we can teach and share our views in this 3D environment, and for the patients too, because a lot of patients they smoke and have a lot of problems related with arteries, but they don't understand. So we can share their view and the problems related with there in the future. And for last, a lot of possibilities related with research that we can create with that. So we understand that, we know that we can achieve our goals, but nowadays we cannot use this technology for everybody. And why is that? I think that two big problems, lack of investments, that it's very expensive, this technology, and adoption, even for the patients and the doctor. That. And how can we get there, that you and we create and use this technology? We think that we have a lot of possibilities to increase this digital technology. We have to design technologies that the patients will use and the medical professions that use. So the possibility, the only way is to build this technology with the help of the patients and the doctors. We have to test this technology before. We have a lot of concerns about privacy and security. It's natural, but we have some possibilities related to regulation to make this more safety to the patient. One important thing to me, it's related with integration. We are developing technology all over the world, but we have to integrate what we are doing here in Brazil to what we are doing in Egypt and what we are doing in Europe to everybody using the same platform. And we know that technology, it's expensive, but the use of more and more times, it's become the technology cheaper. And we have to remunerate the physicians to use this technology because it's cost effective in the end of the day. So it's very important the adoption to everybody use. We think that the investment have to be from institutes, departments, university, and government because as I told you, in the end of the day, it's cost effective. So it's important to everybody use to achieve our goal. And two important things, everybody just uses training. So we have to train physicians first and other health professionals and patients about this technology. And the only way to use that is if we give support, because even if you're trained, you have you have doubts and then you have to give support. Something very important about that is that the most used technology in digital health is televisit. With the COVID-19, this increased a lot. So if you see this data from American Medical Association publishing 2022, we see that in 2016, just 14% of the doctors use televisit. And now 18% use. So that showed to us that is changing a lot the possibilities that the doctors and other health professions can interact with the patient. So for us, that's very interesting. So what's the next step? So, okay, now this is a reality, but we can get more. And what is this more? So for us, the metaverse, I don't like this word very much because I think that metaverse, it's a word that everybody uses for everything, but it's the only word that have. So the metaverse nowadays will be, because we don't have nowadays, but will be a three-dimensional environment which use VR, AR, and mixed reality and artificial intelligence, where individuals can interact with each other in avatars, mimic a real-life experience. So that what we have to use, and it's related with blockchain technology. So for us, metaverse could bring to health three important things that bring assistance. And why assistance? Because telehealth nowadays, it's just a Zoom call that patients is one side and doctors in another, or other health professions. If you use a metaverse, you can interact in different ways. You can go to all the journey. You can go to another doctors in the same environment. You can interact with another patient. You can go to a pharmacy. You can do the whole journey. Second point about the metaverse, it's the possibilities about education. In the same place, you have a lot of possibilities in education. As I told you, I can show to my fellows how can we make a surgery, and that way you can show how to use a device. The patients can understand a lot of possibilities that are health. And the last, for me, very important, is to create a community. Because if everybody is in the same environment, you are creating a community. That's very important. Patients interacting, discuss about their problems, medicals discussing about difficult cases. We think that's very, very important. So now what we're doing here is try to create this kind of view. We know that the technology, it's not enough, but we understand that the only way to do something is to start. We have the best technology nowadays. We need more technology, but this technology is not available in the world nowadays. But we have to start because we have to create something that we want to share. I want to share to everybody a small video. I think that's not so small, but let me try to share with you a video about what we think about the healthcare. So this is the first hospital in healthcare. It's a reception. I think that reception, it's very, very important because it's something that will create a community, because patients can share a lot of possibility, encounter medical doctors, share with everybody their view. Something very important for us, it's a reception, because as I told you, the patient needs and the doctors need the support. So we have a possibility to share our views, how can work the platform. So it's important to have a reception, to interact in this way. And then inside the hospital, we have 3 different kind of possibilities. The first one, I like it very much. It's something that we are doing a lot. It's something that we can, it's a meeting room that where health professions from different kind of specialties can discuss case, discuss digital health, and can share presentations, and can together, they can create something very important with health. So it's a room where we can share globally. That's the idea, with different kind of medical professors to discuss. Another point for us important is the education. So we have one auditorium that we like to show. It's auditorium. It's very good because if your avatar globally, you can go to the meeting or some conference, and you can share your presentation and discuss with different kind of locations. We think that's very good in health because it's something very important. We already made some encounters with the patient too, and very good. And for last, we have some consultation room. Let me show you one of these consultation rooms. It's like telemedicine. We have doctors, we have patients, we have a room like a consultation. But we really think that's different from telemedicine because of this interaction. We can show a lot of things, the documents, and if you need, you can share your face if you want or not. I try to show, that's my face, trying to show this idea. We think that's good because it's important to patient and the doctor share a face. And this, it's some place that the patients can interact to discuss in the community. It's our idea to create a community. And for last, we have the possibility to build something different. Let me show what it's right in there. It's operating room, do not enter. It's not possible yet we cannot do wherever we want, but it's the possibility to, in the future, we do a lot of other possibilities in the metaverse. So we understand that technology, it's just the beginning. We can do a lot of things with technology, and the first thing that we have to do is the idea, and then the technology go just with us. What we really want to build, and we think that the idea of the metaverse is to create a community where professionals, medical industry, everybody that is related with the journey of the patient can connect and deliver healthcare in the best way globally. Thank you a lot for viewing my presentation.
Thank you so much, Dr. Antonio. You know, I'm a big fan of what you guys are doing at TV Health, because I also I have been working on similar solutions also for the past couple of years, and that really, I love your analogy. That also fits very well with what Dr. Fadi was talking about. That the metaverse, or whatever the technologies are, regardless of the words that we are using, but it's not only about the devices or the tools that we are using, but it also goes very well with how we use these technologies in order for us to achieve the communications that we seek between the healthcare professionals or the patients as well, and also the education part. So the metaverses, I love that analogy, that it's more like, it's not what Facebook is actually building. It's more like the natural revolution that's happening in the communications. All of us, we can remember back in the 50s when we used to talk to each other through a landline. So you have to speak over a device that's connected to the wall, actually. And when the cell phones appeared, it was like a very, very nice, like, oh my God, we can hear each other and we can text each other instantly. And with the smartphones, everything went viral, like, oh, like we can do this kind of interaction across the continents, like we are doing now with Zoom. So the metaverse, I believe that it's more into the immersive technologies like virtual reality, like the Web3 technologies, and involving so many great and amazing stuff that I also could see. And I guess that room that you guys didn't enter yet, we can talk about entering it together, because I believe that there is so much that we can do inside of the virtual worlds. Maybe one of the things that I have recently seen is that the doctors and the healthcare professionals are sharing the patient scans and the DICOM files, so where you can not only see it through a screen, but you can actually hold the patient scans in your hands. So that's really nice. And thank you so much for all of these, insights. I'm really very interested in your project. And we have a question. Anonymous attendee, how you see the adoptions and acceptance of the patients to use the new technologies like metaverse. So you can see the questions and answers, Dr. Antonio, please.
I think that the healthcare area, it's a very conservative area. So in the beginning, everybody it's a little afraid about it, but it's something that everybody, because of the telemedicine, will adopt in the near future, because the telemedicine showed to us that everybody nowadays in the world can use telemedicine in some cases. So the next step for me, it's the metaverse, because it's easier to the patient use that, because it's more interactive. The beginning is difficult, but I think the next years probably will be the future, because it's easier and everybody wants to interact. The problem about telemedicine nowadays is that the patient and the doctor, it's not allowed to interact with another patient and another doctor, and the metaverse is allows this. So I think that's a problem today, but with the technology we can do this. I think so.
Thank you so much, and definitely yes. I mean, recalling the blockchain technology and how some countries are using the blockchain technology in order to encrypt the patient data. So, I mean, answering the questions about the safety and the security of the patient data, which is a very sensitive file that I believe is one of the major challenges for the digital health. Like, okay, what if the systems got hacked, for instance? So how would you make sure that all of these patient data that you're collecting is not going to be somewhere for the public use? So I believe yes, and I truly thank you, Dr. Antonio. And we will definitely get back to you with the panel discussion, speaking more about the metaverse and the augmented and virtual reality. But let's move from here to Dr. Veronica. So, Dr. Veronica.
Here I am. So I will share my screen.
Sure.
Can you see my presentation now? Okay. Okay,
yes,
so actually, well, thank you again for being invited to this webinar. And actually, well, I have to talk about the future of neurorehabilitation, and I think it's a topic that I could talk for many hours if no one stopped me. So thank you for leaving my time to 15 minutes. Actually, I wanted to start just going directly to the point. So actually, there are some changes in the population. So the pyramid is changing. So this is actually translated to more elderly people now and less young people. So what can happen about this? So in 2000, this you can see that the solid color in this graphic is 2019, and the ones that it was not solid, so you can see how it's going to grow this population, this range of age of the population for the year to 2050. So actually we are not super far away from it. I mean, we are actually arriving, right? Time flies, but are we actually ready for this? Because, for example, for Europe and also in the whole world, we have different, in here we have the ranking of how number of practicing physiotherapists we have per resident. So actually Norway is one that it's the most, that have 2.5 physiotherapists per 1,000 residents. But this is not the normality, right? We can see 1, 0. So more or less we can say, okay, let's say it's 3. But if we saw before the pyramid, this is going to change. So we don't have enough physical therapies for all these patients. And actually these patients, I mean, one of the risk factors of, for example, a stroke, because I have to always choose a pathology to base all the presentation, right? So I choose for today the stroke because it's the most common one between elderly people. So we can see here that there is no balance between the resources that we have, so the physical therapists and all the clinicians to treat these patients, and also with the demand in 2015, right? So actually this is some pictures that I always put in the presentations during my lessons with the students. And actually you can see here 4 different pictures in 90s, even maybe before, right? And for example, for the postman, we can see this has changed a lot in these days. Also the communication, also the education. I also teach in an e-learning way. But for example, with physical therapies, even in this picture, we can see a child. We can still see these parallels, right? In every gym of physical therapy, of rehabilitation. We still see it. So it's something like, okay, maybe change. I mean, I know that has changed because I am studying all the new technologies in neurorehabilitation and also between my field, right? But this is not super extended. So for example, just to give you a perspective, I really like to show this picture because this is something that we can take for many ways in our life, right? I use it to say that, okay, I study for very vocational part physical therapy. And at some point when I finished, I was like having this kind of thoughts that I think everyone had when we finished the degree, right? Like, okay, and now what's next, right? So I was thinking about this. I saw this pyramid, these changes in the population. So I was like, okay, but we have this balance that I just showed. So okay, maybe in the future we should do something. So what is the future waiting for us? So if we have a perspective of the stroke patient rehabilitation, we can see three big differences of how we can be treated as patients. So we have the home therapy, where the patient is at home and can do telerehabilitation, for example, that we will talk in a minute, or also the therapist or the clinician that goes to the house, for example, right? These patients that cannot really go to the hospital. Then we have the outpatient hospital or outpatient centers, which are the ambulatory patients we call, right? The patients that normally are at home, are living at their homes, but they go and they travel until the hospital to be treated. And then we have the inpatient hospitals or centers, where are the patients that are living there, right? So for example, if we have a stroke, we are going to stay in the hospital for maybe, I don't know, 2 weeks, right? So this would be the inpatient part. So if we take the, I didn't see it because I have the pictures here, sorry, in this part of the screen. So it's around 60% of the patients that had suffered a stroke are being treated in outpatient hospitals. So let's see, and this is, I mean, I know it's Saturday, I'm also the last one, so I just want to give you something to remember, which are what I call the 3 E's. So efficacy, efficiency, and economically. So we can see, for example, in this picture, this is outpatient centers, right? So in this picture, we can see 2 clinicians that are moving each of us one leg of the patient. We already have some technology here because it is a treadmill. We also have body weight support, but actually this is not efficient. It could be efficacy, I don't know until how much, but it's not efficiency for sure. And also not economically, because I mean, these clinicians, for sure, at some point they will be, they will have some pain in the back. So maybe they have to go home and not to work for some several weeks, right? And then we have, for example, this part. So in here we have the Locomat from Ocoma, which is, I mean, the video just talk by itself, so we can see its efficacy, its efficiency, its economically. Actually, in this video, then I saw the 3 clinicians just looking at the patient. So I mean, they could be also just supervising the patient and treating another ones. But yeah, it's something that we were also like, we always see that, right? But yeah, these 3 we can have it in the outpatient centers. In the outpatient centers, we also can have the augmented reality or the virtual reality. Sometimes I don't really like to highlight the difference between both, because also in literature there are still some gaps, and some people calls virtual reality for everything, or augmented reality, it's not really define it well. Actually, I had several thoughts during the while I had to choose the title of my thesis, because nobody knew it. Some people were saying like it's mixed reality, we just say extended reality, but extended reality, it was not also super famous, right, between clinicians. So yeah, I was a little bit in the middle. So for example, in this one, we have the Nirvana, which is from BTS Engineering in Milan. And this is the one I used for my thesis, for example. In here, you can see different games that we could choose. And this system was developed ad hoc for the patients. This term to be developed ad hoc for the patient, so it can be adapted for the patient. So for example, in here I can say how many chords of the guitar I want the patient has. I am the one, I mean, I think physical therapy is the best tool we have. It's the creativity, especially when we work with children, because we have to give games and not just say, okay, just do these 3 repetitions, 3 series of dot repetitions, right? No, we have to do by the game, because we are rehabilitating the brain, and the brain does not understand about isolated muscles, but about functional movements, right? So not flexion extension of the elbow, but take a glass of water and drink. It's different. So we are not in the muscles, we are actually in the brain. This is the most creativity part of the job. And also in here we have the virtual reality. For virtual reality, I also participate in one study where we were using different apps that Meta has, like Fruit Ninja and Beat Saber. This, I like it or not. I mean, at that time, it was the only thing that we have. So sometimes you just have to, to profit the things you have. But actually what would have been the best option, some games develop ad hoc for the Oculus, right? In here, I would like to show you some videos that we take from some patients. And in this one, for example, it was a patient in a wheelchair. And this is also, I think it was from Meta. It was Creed, I think, and he was just fighting, doing boxing with Rocky. And it was also something that they totally forgot about. They are in therapy, right? And they are super involved and motivated. And then it's also super nice because, as I said, we have creativity, physical therapy, so we can just stand the patient and do it the same, right? So here it was very important, for example, to do this tutor for being in a standing position, because the patient normally never is standing up, right? So fighting with Rocky at the same level of the eyes, not just like this, it was very, very nice. And the patient then was super emotive, right? So this is something that always brings emotion. But as said, Oculus is not the best part, right? Then I was talking about the outpatient hospital, what we can give the 3 E's, how can we bring the 3 E's to the outpatient hospital? Now we can see in the home therapy, which is around 50% of the patients, of stroke patients, are also having. So for example, I'm very fan of these two companies. I select one of AR and one of VR, even if I said I prefer to say always extended reality, but sometimes we have to just differentiate some things, because, for example, it's not that one is better than the other. I don't think there is something for everything. It depends always about the patient, for example. So in the case of the AR, it's very nice to use in some patients that are maybe more severe, or also if they are combining this AR in another device, for example, it's better to have augmented reality. Why? Because they are not missing the real input from the eyes, right? I mean, they are not totally in another world, because it could bring or sick motion sometimes still, depending also of the reality of the games, the presence, the embodiment, and everything. But also because, for example, for me, if I have to do some therapy with patients, for example, elderly people or something, I would at least start with AR if I know, or if I see that they are not super convinced to use this new technology, just because they are not familiar, that's it. But maybe then in two sessions, they really want to try and they prefer the other one. So at least we have to always show both, right? And then also XR Health, I really like it because it's also promoting a lot the telerehabilitation. And this is where we are going to, we were talking now in home use. And this is something very important, because it's not only for stroke. In a stroke, actually, we always have some improvement. We always improve because we have a damage and then we recover it. But there are another pathologies that are degenerative ones, like multiple sclerosis, for example, that the best we can do is to stop, because we cannot actually stop it, and make it go slower to the patient, right? So to the effects of the patient. So it's something like could be really frustrating also to the patients, also maybe also to the clinicians, if we are very empathic, right? But it's something that can help a lot, because they are not only depending on how they can pay the sessions, but also doing at home, right? So, and actually this is something that we can also see, as you can see here in XR, they are also, the physiotherapists are there. So it's not just doing something because like you put a video in YouTube and that's it. No, you also have your therapy there. So you are always with someone going with you to the therapy. And then the last part, inpatient hospital. And inpatient hospital, now I'm very, very happy to see this kind of news that I will show you in a second. But the inpatient patients, normally we're always saying like, oh, poor them, they are super severe, so the best thing is to not touch them. No, actually it is not, because the brain As you can see here, the neuroplasticity works better in the first hours, in the first days, until 6 months. When we arrive to 6 months after the brain damage, we are arriving, as you can see here, to know a lot of margin of improvement. So these hours, these days, these weeks, these months, these 4 months are the most important ones to give more input to the brain. So I saw this new that my parents sent me from Spain, and I was very happy to see because it was during COVID times, and the patients, I know, I think you would know that the more time we are immobilized, more muscle mass we lose, right? So then you have to rehabilitate it again. So it's not actually like, okay, go to improve the neuroplasticities in the beginnings. No, it's not that. It's also, I will put it again, sorry, because it was very short. It's not also just avoiding some secondary effects that can have. It's also to improve these secondary effects, because if the patient is going to be severe and it's not going to be independent, also the family has to be around them, and the family has to ask maybe to the to their jobs to have more time for cure this family member, for example, right? So it's not only the patient, it's everything that makes the patient have to have more families around, for example, family members. Okay, enough. Okay, so then it's like we were talking about the threes. We saw the efficacy, the efficiency, and economically. But the efficacy I didn't even highlight it, so I will just talk about this systematic review, which has, well, the aim of the review was to study the effects of virtual reality on neural plasticity changes. Of course, as I was saying before, this virtual reality, I'm not sure about what it is, because if you go then to the studies, you can see some were augmented reality, some not. So I think that this is something that we have to really say for literature publications. And then we have, well, the methodology, where pre-post assessment of virtual reality intervention with neuroplasticity measurements from studies from the 2000 to the 2021. So the results were like, first of all, the virtual reality improved interhemispheric balance, enhanced cortical connectivity, increased cortical mapping of the affect limb muscles, also improved neural plasticity measures that were correlated to the enhanced behavior, and increased activation, virtual reality increased activations of regions in frontal cortex, so where the motion it's born, and the mirror nervous system, it's also involved. So we can conclude that for all these studies from the 2000 to 2021, that virtual reality induced changes in neural plasticity for survivors of stroke, and positive correlations between the neural plasticity changes and functional recovery eludates the mechanism of VR-based therapeutic effects. So thank you very much again for the invitation. I hope I did it in 15 minutes. And something that I always want to share is that if you want to go fast, go alone. If you want to go far, go together, because I think it's like, I don't work for many of these companies, but I think just to let know the others what also you like, even if it's not the thing that you are working on, it's always nice, right? So just share always the things that you try and you like.
Thank you so much, Dr. Veronica. That was really insightful. I bet that many people will have a lot of questions about that. And also, I mean, I like how you started working with the challenges that we have in virtual reality, like the accommodation versus conflict, for instance, the problem with the cyber sickness, that some patients usually they feel like some sort of symptoms of motion sickness, and augmented reality definitely it solves that. But yet it's we didn't reach that level of commercialization that we can see with the virtual reality headsets. However, I love your approach, starting first with the augmented reality and then testing the virtual reality. I mean, that's really nice, and I will have a lot of questions on our panel discussion. So thank you so much. And let me tell everybody that we are starting our panel discussion, and that's going to be the point. If anybody has any questions, also from the Facebook Live, the LinkedIn Live. So please, Madeleine, our host, would get those questions and post them so that we can answer on the live session. So I like the let me tell you that the common factor among all those three amazing sessions, the Dr. Fedi, Dr. Antonio, Dr. Veronica, that all of us, we are speaking somehow about the digital technologies and how they are fitting in the healthcare industry from different perspectives. So, for example, I love that part of the 3 E's and how that we should think also not only about the technology, but also about the economic status of the technology. Like, it's nice to have the technology on hand, but are the patients and the healthcare professionals are being able to adapt those technologies? Is it affordable to the public so that it can go commercial? And also Dr. Antonio, who's speaking about sharing those kind of communications. So let me get back to Dr. Fedi, since he was the first one to bring to the table the social media and the apps. And I believe that Dr. Fedi is having an amazing experience that he has been developing this kind of social apps for the past couple of years. Maybe you can share with us some of your experiences, Dr. Fedi, about the communications on those kind of platforms. How do you think it's very important for the healthcare professionals to get connected to each other, and how does that reflect to the patient's quality of life?
Well, thanks, Mohammed, for bringing this. Actually, it's really, I have a good story even about this social groups, even or social media utilization, because and the interaction even between physicians on the social media and in this kind of interaction. Like in 2020, in March 2020 exactly, I had like a social media group, and its idea was what we are speaking about. Now we are having the virtual world, and I need to bring all the physicians. At that time, it was the cardio, and it was a group called Dr. Beats, matching the heart rate as well. So I wanted to bring all the cardiologists internists into one group so we can share experience. The ones we are sharing like experience, case studies, patients. And the coincidence that once the platform was ready, actually, COVID happened in March as well, in mid-March 2020. So it was a good platform that physicians could interact. And I see a question here in the panel, seeing the difference between developed and developing markets. From the expectation that before the COVID, if I launched this platform, I didn't expect this much of appealing and attraction to the platform. But because it happened, or the launch happened at the time of the COVID, it was the only channel that physicians found that they can interact. And this even encouraged me to boost the platform via live streamings, via interacting case studies, via using the GIFs, via using even integrating like something like the Heart Songs even platforms. So I put educational part, sharing part, live streamings where it made it easy for all the audience of the physicians to come and interact, because they felt that it's the media or the place where they can talk, because now there was no physical interaction like 2 years even ahead. So this is the when you are ready, which is, by the way, the thing that we usually think about. If you are ready with the digital assets, and then you found what's the pain point happened, which is now no, and it was the point, no physical interaction, what you will do. And you will find that even if we speak about, we are talking now through Zoom. Zoom actually gained billions in this year because of or it was ready, and he developed, by the way, and there was a need. And the point as well happened in the social media group, because I had the readiness, I had the content, I had the platform and the media, and then now I having like more than 10,000 physicians on the group, chatting, sharing experience, giving more experience to fit with the patients, and even to improve educational part. So we divided the social media group and developed it into phases: educational part, interactional part, and even we had fun, because we know that there was kind of emotional part for the physicians during the time of the COVID. So I decided to bring one psychiatrist so he can show physicians how they handle the panic of patients during the time of COVID, and even how physicians can retain their stability during the times of COVID. So yeah, it's really helped at that time.
Thank you so much. This is really insightful because yes, I recall these times of the pandemic, and during the lockdown times, the Zoom and the digital technologies and the digital platforms were the only channel for us to keep communicating, not only with on a professional level, but also on a personal level. I mean, you could connect to your friends. That was the only way. So yes, I believe that the pandemic helped a lot with the digital transformation, and I guess that also was one of the drivers for Dr. Antonio to start his metaverse platform. It also has the same concept of connecting people together. And if I may also talk about this question that we received about the difference in the developed and the underdeveloped countries of adopting the digital health, I guess there are two conditions that we need to think about. Like, first of all, the people and the healthcare professionals, we need to understand more about the value of this digital transformation. So once we believe that we can see the value of doing this, how it reflects to the patient life, how it changes actually the patient life to the better, I guess we will be ready by that time. And the second thing is the ease of use of the technology. So for example, all of us, we used to do Skype. So we had a previous experience with the same concept of telehealth or the telecommunications. So that's why when the technology came, as you mentioned, with the right time and the right moment, I believe that everything went to the best side of it. So we have also Rania Sulaiman. She's having some questions. She says, do you remember the problem that happened in pacemakers, that their battery died before the expected time? If there was a proper monitoring system, problem would not have been disastrous. Yes. Let me add that during COVID, telemedicine started to evolve. And I believe, yes, I guess Dr. Fedi, he's the one who's speaking about the importance of the gadget and stuff. I'm not sure that, Madeleine, maybe we can bring Rania. She's very active with the Q&A session, so maybe we can bring her to the stage. It's a discussion, so everybody would be happy to share that, I guess. So maybe Rania can join us to the panelists, and maybe Rania, please introduce yourself and share with us.
Well, hello. I'm Dr. Rania Sulaiman. I'm General Director of Medical Devices Marketing Authorization at Egyptian Drug Authority. I'm in charge of approval of all medical devices imported to the Egyptian market. So actually from my work, I monitor several problems related to medical devices and related to telemedicine that really evolved after the COVID pandemic.
Hello, Dr. Rania, yes, we can hear you.
Okay. So what I was talking about, that the disaster that happened for pacemaker, that their battery died before the expected time. And because at that time, there was not a very good monitoring system that can alarm patient that their battery are dying, what happened actually, that patient died already because of bad monitoring system at that time. I think this problem is much better now, and there is a much better vigilance system for medical devices companies to monitor their devices.
Yes, sure. Thank you so much, and it's really an honor for you to be here with us. Maybe Dr. Fedi, Dr. Fedi would like to comment on that.
Actually, yeah, Dr. Rania, you reminded me even with even a device. My friend actually is like an engineer as well, and he is moving with. This is the mix between digital engineering and the medical part. And they are now even developing some kind of a device that can be like the Holter device or something like an ECG device that is remote. It can be wearable as well. and it sends all the data about the patient directly to a system on the cloud, and then the physician who is treating the patient can detect any deviation in the ECG or in the heart rate. As well, the Apple part, which is really important, because I searched for, there is a survey for Apple using this kind of SOS. And in other countries, you may find that if the heart rate exceeds a certain limit or something that shows a risk, it already sends directly to the emergency, to the ambulance to come and get for the patient. So, but by the way, so even in Egypt, we are having this kind of technology that is being developed, like the Holter one that I'm speaking about, which can protect the patient even if the pacemaker is impacted. We can get emergency directly at the point that is needed, and even if there is a risk and some kind of deviation, it can be early detected. This is the edge of the technology. So of course, this is a very valid point. Validating the devices with another kind of smart thinking or artificial intelligence integrated with these devices may secure the patients, of course, in the future part. And again, I can be back also to the second question about telemedicine, because if you remember, and I think in Egypt, if I remember, like before 3 years, before the COVID, if I ask a physician to attend a virtual conference, it would be not this kind of, what application? I need to download an application. It's why I should attend the meeting. It's face-to-face, it's better. But then after like 6 months, 8 months of the COVID, you find, no, I like Zoom more than Blue Jeans. And you find them more connected. And even you find this, because we have innovators and we have other, even not innovators in this part, but you find all, even the middle technology savvy doctors are adopting the technology, and they're adopting and getting connected to the telemedicine platforms, and even giving like the prescription, even the face-to-face through the virtual system. They even ask to learn how they can use the virtual. So this is how telemedicine even improved as parallel as the virtual platforms.
Thank you.
Thank
you so much. It's pretty clear, I guess. Also, let me move to Dr. Antonio, also to share with us, since we are talking about the telehealth. I'm not very familiar with the Brazilian market of healthcare. Would you like to share with us how it's going there, the telehealth, Dr. Antonio, since you're a surgeon? How come the telemedicine would fit with you as a surgeon, for instance? Of course, you're not doing let's say a tele-surgery or something. So would you please tell us, how do you think the telehealth is moving forward?
The telehealth grows a lot in Brazil after COVID-19. We don't use it a lot. It's incredible because Brazil have a lot of projects related with telemedicine and telehealth, like 10 years ago, 5 years ago, but they just increase after the COVID because of the regulation. The Ministry of Health here in Brazil not allowed us to use telehealth before the COVID, and then because of the COVID, allow us to use, and it grows a lot. In my practice, I use a lot not because of the surgeries, but we make a lot of surgeries, and patients in other cities, states. Brazil, it's a big country, so it's not so easy to follow up these patients. And telemedicine and telehealth, it's an excellent possibility to connect with these patients in different kind of cities and states. So it's very good and it's growing a lot. I think that's something that everybody needs to use because it's very helpful for the health, and in a big countries like Brazil, it's very, very important to bring health to different kind of places.
Yes, actually, the reason I'm bringing this up to the table is because most of the people who are a little bit skeptic about telehealth, they always tell you, okay, telehealth is not going to work all the time. It's not going to be for all specialties. But at the end of the day, if we look closely I believe that we can find something like for example, the use case that you are telling us right now, which is the telehealth becoming like a post-operative practice to kind of monitor or follow up with the patient. And that is actually a very, very nice, topic to move to maybe Dr. Veronica and tell us more about the use case of the digital technologies like virtual augmented reality with the post-operative practice in the hospitalized patients, for instance. I mean, I have read a lot in literature, some stuff about the pain and stress management. And I could see that some of the cases, it can get like a 30 to 40% pain reduction actually using virtual reality. So how do you see virtual and augmented reality not only being part of the telehealth, but also helping the patients in the hospital setup?
Was for me, right?
Yes, please,
Okay.
Dr. Veronica.
Setup, I mean, what do you mean with the setup in the hospital with virtual reality, augmented reality? You mean?
I mean the different use cases. So for example, we were talking about the telehealth and using those kind of devices, virtual reality for doing some telehealth. But I believe that virtual reality has more to offer to the hospitalized patients.
I understand the question, but for me, setup normally is, for example, as also I work with robotics, for me, the setup is how to put the patient in the...
Yes, with the Oculus Quest now, there's no special
like,
setup. Well, excuse my non-academic terminology, but yes, this is... Sure.
Okay. No, I mean, the thing is that the virtual reality in hospitals, I mean, it could be from many different patients, but it's what I was saying also during the presentation. It depends on the patient. I mean, not all the patients have the same needs. So something that can work with one cannot work with the other one, maybe because it's not what he needs now, because it would be in the future of his or her rehabilitation. And also in another patients, it would be like, for example, I remember this is, I mean, this happened to me during my thesis, during the recruitment of the patients, that I was totally honest with one patient. I was like, look, actually, you are very well. I mean, I don't want to include it in my thesis, but not because of me, because I would like to have more people, right? I mean, in studies, you need more patients. But I was like, look, if you really were my father, I would tell you, go to the gym and just, for example, take the personal trainer and explain what do you have and everything. But this is not going to work for you, because, I mean, if you are here, I can improve you until here, but this is for more severe, right? More mild patients than you. I mean, he was super good. So you also have to be ethic with your job. It's not about selling. It's not about also taking care of patients or do the rehabilitation, but you have to do also the ethics, because if I, for example, include him, then my results were totally with no sense, because it would be like, okay, it doesn't have efficacy, for example. But actually no, because I have this one that I have, it was a how do you call it now? I forgot. These ones that outroll, right? So you have to delete in the statistics. So yeah, I mean, it depends of the patient. It's something that's why maybe I don't like protocols in medicine, and this is something that related with the question after one of the presentations. I think there is also a gap that we need to fill, because it's not about the age of clinicians, because many people think, well, the clinicians that are already like, I don't know, more near to the retirement, rather than the youngers that are more interested in the, I don't think so, because I didn't see that. I mean, I saw some clinicians, actually some physical therapists, that in a couple of months they were going in the retirement, and they were in the lunch break, Vero, can you show me this, because I have a patient, maybe I saw you were doing this and that, so maybe I can also use it for this patient. What do you think? Can I also play with the games, right? So I can also experience myself what it's like the embodiment and everything. So Yeah, I mean, I think we have to fill this gap because also some young people is not even super defensor of the new technologies. I mean, it doesn't make sense of the mind of the age. Is more about the mind. So it's there are very modern people also with 80s. So it's not about the age.
Exactly.
But
I completely agree with you. I completely agree because I mean, on a personal level, I have dealt with some people. Yes, like I love how you call them the people near the retirement part, and they are completely tech savvy and they are very into attending this kind of webinars, speaking about digital health and following up with the different technologies and seeing how they can actually apply that in their practices. And I mean, the digital technologies and especially that part of augmented and virtual reality, it's still under question. I mean, we're still didn't unravel all the mysteries about these technologies. Like virtual reality has started commercially speaking in 2012 with the Oculus Rift. So the technology is still like 10 years old for me. And the digital applications of the technologies also, you can find a very, very, low number of literature about these topics. So that's really amazing, and I guess it also can be implemented with what Dr. Antonio is doing. So, for example, the educational part. I mean, how do you see the virtual augmented reality working with the training and educational medical education part?
yeah, actually, I was going to that point now because, for example, in my university, I already said after the PhD honor, so during my PhD to some professors, like the only slide I saw during my bachelor was one slide when you can see a picture in black and white of the Locomat, for example, because it was in the 90s, right? And I was like, wow, this like the only thing that it was a little bit I don't know, futuristic, right? And I was like, okay, just super excited, also curious, so I was looking for it. And then after my bachelor, I was directly to the new technologies, right? But I mean, it's like, for example, also for the, I don't know this in different countries, I think it's also different, but for example, from some colleagues that were more in musculoskeletal parts. So for example, they are physiotherapists in a clinic and they have to do maybe some ecography. I mean, in my bachelor, we don't have ecography, so we don't know actually how to do it. So you have to do your courses by yourself, pay it yourself. And you are, I mean, before to be asked to do something, you have to teach it. So we cannot say, and this is something that I'm struggling a bit because now it's super trendy to use the virtual reality with patients, also for marketing. So you can have more patients going to your clinic, right, or to your hospital. But okay, but do you know how to do it? Because I would not do a massage or some techniques if I don't know how to do it. I mean, to do something wrong and then have some problem, I would do anything, right? And I would say, look, I have a friend or a colleague that it's better in this if I knew something, someone, right? But this is not the thing. I mean, it's like, okay, yes, and this and that, or maybe some people also adding some, I mean, there are two different professionals now, well, more, but one of the things that I'm saying, it's like the big ones that are just trying without reading or without learning or just because it's a trend and I see this in social media, so I just copy it. And other ones that are like, okay, I'm going to be like super into the topic, so I'm going to read a lot. Yes, but research is not always the whole part, right? It's only one part. So you have to have the experience, you have to read, you have to do, you have also to exchange with other colleagues, right? Because I mean, maybe
Yes.
I tried this and another one tried other parts, right? So yeah, just stop me because
Yes, that's no. I mean, actually, bringing this point is really important, which brings us to the topic of the question that we have right now in the Q&A section, which is what kind of technical skills? I mean, the IT companies, do they really rely on IT and software engineers only, or do they really need some medical medical expertise with them to work on this kind of solutions? And I believe one of the best answers I got one day was from Dr. Fedi, because the day I met Dr. Freddy for the first time, I could really realize that he's very into the digital technologies, even though he's a pharmacist. But at the end of the day, he kind of studied those kind of different disciplines, the digital technologies, the software industry, and he has a very, very good understanding of the user experience, which here in our case is the patient journey or the patient experience. And actually, I believe once we study those two different disciplines, that brings us to the point where we can perfectly design those solutions and we can understand exactly what are the needs of the patients and the healthcare professionals. So I believe this is one of the biggest challenges. Dr. Fedi, how do you see this? I mean, how do you see the digital technologies? I mean, do we really need some software developers only, or maybe they have to be coming from a medical background? How do you see this this dilemma, let's say?
Well, actually, Mohammed, this is, when I was hearing actually Dr. Veronica saying this, it's really 100% true. And even I also have seen the question. It's really a big link. And I had this challenge. You remember when we met? I had this challenge before, because you have some things in mind, and usually if you have, it started like this. When you have developers, they work mainly on the development of the thing, but to link it to health, it requires, of course, like research and data about what's behind. So this was the challenge that I was having, because this is why even I searched, because I'm fond about the digital part, and my friends actually, they are engineers and in this field. So I had this kind of insights. So when you know the pain point, you can see how you develop technology to fit this pain point. But usually the problem, and I even recall what Dr. Veronica was saying, it's not about just I'm having VR. So I'm as a developer, I'm just providing you with a VR. I'm providing you with AR. This will make your event magnificent. This will make your approach. And sometimes, by the way, developers go with an approach like you would be unique in the market. XYZ companies are using this kind of technology, so you need to stand out as the others. But this is not the ideal case. And you see that companies who moved in this direction with adopting technology just for the sake of technology, just having AR, VR, hologram, and all of these things without having a real rationale or a link to the business, they didn't cope with this, and the applications didn't fly. It's just development, and then it stopped. But our applications, of course, that we developed, it's for a reason, it's for rationale. So usually when you are talking about development, sometimes developers have ready-made solution, ready-made application that already they are promoting. But the other side is when you get the insight of the medical or the need or the rationale, or we talk it even in marketing, it's the situation or the environment that you are working with. Then you will customize an application or a platform or a VR or a hologram that fits the real need. Then this will fly and this will continue. So of course, there need to be a link between the IT, the developer, and the mindset of the either the healthcare system, the physician, the pharmacist, the company who wants to deliver something to the patient, because this link will create something unique, something that will be long-term, will not be just like a spark using we are just speaking terminology. We are going digital. No, it will not be the case. It will be the real utilization of the digital part. Yeah.
That's amazing, and actually it's an amazing answer. And I'm a little bit curious also about Dr. Antonio, because Dr. Antonio also, he kind of experienced this multidisciplinary part of developing and the software part, adopting the metaverse and the technologies of the Web3, as well as he's being a surgeon. So would you like to share with us, Dr. Antonio, how it all started with you? I mean, getting into the digital field, because maybe that would promote the idea of maybe we have many pharmacists and healthcare professionals today with us on this live. So maybe somebody would be interested to get into this field. So would you like to share with us your experience?
Yes, I think that everything is related with health, but because what we really want to do in the end is to bring health to the population. You have a lot of parts with doing this. The physical environment, just the physical environment, it's not enough nowadays. So what we understand is we have to give the next step And these possibilities that came with the technology bring a lot of opportunities to deliver education, deliver health, and bring a lot of possibilities. I agree with Dr. Fedi that the digital health is not related with technology. I really believe that everything is started with idea. Okay, we understand that physical environment, just the physical environment, that not believe that. So we have to put health in another's perspective and then bring to us the engineers, the developers to this thing, because just the engineer for itself, he cannot develop the idea of the health. So that we start with the user view, and in my case is the doctor view with the patients, and then we develop that. I think that what we want to do is to bring more and more medicals and other professions to this view, because what we have to do in digital health is to bring everybody to this, to use the new technologies, to integrate. I really believe that the integration is a big part of this project, and then to spread this idea. So I really think that medical and other health professions are more conservative. So what we have to do is to do this, what we are doing. It's try to discuss, to show that have a lot of other possibilities. And the problem is not related with technology, because what we're using today and what we think that we can do today, probably we cannot do. Now, we cannot do a surgery in a metaverse, but I don't know, like in a couple of years, you can do that. So what you have to do is think and create a strategy that the developers and the engineers can bring with us with this idea. I really believe that. I don't know if you believe in
That's
that.
amazing, actually, and definitely yes. I mean, the medical professionals, they will always be the ones who are kind of connecting the dots and putting all the software developers at one hand and all the mechatronics people who are working on those amazing wearable devices and the Internet of Things together, along with the user experience designers. So this kind of mixture, I believe that it needs a healthcare professional to guide and to lead this transformation actually in the digital future. But let me also share with you that yes, being a very big challenge of having these disciplines all in one place. But what also do you guys think about the challenges that we have in the adoption of digital health? I mean, the question that mentioned the developed and the underdeveloped countries related to healthcare in the beginning of the webinar, I believe we need to tackle a little bit that part of what other challenges do we really have? So, for example, in Brazil, in Egypt, and I don't want to get to Dr. Veronica about Switzerland. I'm not sure if they have any kind of challenges with the government or anything related to the healthcare there. But I mean, yes, what do you think we lack in order for us to say that we are completely digitally transforming our healthcare system, Dr. Antonio?
I think that the two important parts about it is the investment. I agree with you. We are in a poor country and it's different for us. And one excellent opportunity is to show to the companies, to show to the government that it's very cost effective, because digital health, if we bring digital health to the countries, we can change something very expensive. Just talking about Brazil is a big country with a different kind of reality, like in a forest in the north. So it's difficult to access everything. So the only way to bring health to the whole country, it's the possibilities that we can give with the digital health. And a lot of these possibilities, like telehealth, like these wearables, like, I don't know, we have a lot of possibilities. And I understand that it's very expensive in the beginning because of the first investment, but in the not so far, but I don't know, 2-3 years, we can change this and can do this something more cheaper. I really think that's that. And the only way to do this is to show to everybody that is connecting. And something that I put in my presentation, very important, it's the possibility to World Health Organization and other big organizations to bring to this idea and try to do this. Another thing that I think that's good, it's to discuss in universities with the young professions, that students, to share this view and try to bring everybody in the same page. I think that
yes, thank you.
is
Thank you so much. I mean, the government, showing the government is one of the most important parts. And since we have one of the Egyptian government representatives here with us, I wouldn't miss that chance to ask Dr. Rania also to step for one more time and tell us about her comment regarding the infrastructure, the internet. I mean, for example, we can't talk about the digital health and the digital transformation of the healthcare system without speaking about the infrastructure that for some countries, it's a big challenge. So Dr. Rania, yes, I definitely agree with you. So maybe we are suffering a little bit here in Egypt, and maybe you can just get our voices to the Egyptian government. That would be amazing.
Yes, actually, in regular areas, we have problems with very slow internet connections. So I guess in rural areas and slum areas, they can never apply digital or telemedicine. It actually can cause more problems than benefits if they're suffering from internet connections, and if they're totally depending on the internet connection and it's bad, it may lead to disasters.
Of course, I completely agree with you, and thank you for bringing up this point. And I guess Dr. Fadi would like to intervene here and tell us how you managed doing this in the African continent, because Africa is also one of the underdeveloped continents, and we are still figuring out ways to introduce digital technologies to so many areas. How did you deal with this, the weakness of the infrastructure, for instance?
Well, actually, Muhammad, I like, even this is a very important one. I will use two things. Of course, one of the 3 E's Dr. Veronica was sharing, actually, which is the economically, which is really clear. And there is a really connection, by the way, with the LATAM region and even with Brazil and with the developing markets. Almost you can find the same dynamics. Currency changes every time. Things are moving in a very dynamic status. It's not that stabilized market. Of course, even within the developing markets, again, back to the segmentation. Not for the underdeveloped markets or developing, let's say it's more into the developing markets. They are not the same. For example, if we speak about Egypt, for example, even Brazil, they are in intermediary stage, not very poor, not very rich. So they are coping, adapting, but at slow pace. Of course, like Dr. Rania was sharing, it's rural areas are difficult. And here goes another layer of segmentation within the patients. If you are going to use the technology, don't use tough applications that already patients will not be able to cope. If you are using a conference, use the easiest one, for example, Zoom. If you are using a channel, use social media, because most of the patients are having smartphones, are having social media, so reach them through the channel that can be easy tackled by them. And then you go to other countries where, for example, let's speak about Nigeria, for example. They already are adopting, but not all, of course, not all the regions, but specific regions. Again, use segment, use email, for example. They use email. In Egypt, email percent adoption is like 10%, but in Nigeria it's 30%. So use the media, use the channel differently according to the country. So again, you put the strategy that you will work with based on the economics, of course, of the country, based on the education and the awareness level of the physicians and the patients and the healthcare system in general. And then you might find, like some of the countries like Namibia in Africa, for example, they are small, but they are highly tech. So they use the technology, even they are developing. So segmenting the countries, and within the countries, segmenting the healthcare system to use the right channel and the right media so you can talk it easier. This can make things move faster. But if you make cross, like getting more advanced technology to less economical part, you will not also win. Yeah.
Definitely, I understand you, and that's a really nice perspective, like a marketing perspective. That once we have a new technology, we don't need to start big. We don't need to start trying the technology on a big scale with many people, because that sometimes, yes, as you mentioned, that leads to less adoption. And one of the best models of technology adoption that I like, as I mentioned earlier, it gets two conditions. That once we achieve those two conditions, the technology goes to the mass market. And those two conditions was the perceived usefulness, as I mentioned. So once the people, they start perceiving the real value behind the adoption of the technology, what it will actually add to their lives, how it will change their lives. So that's the first condition. Once they understand this part, they start taking the technology to the mass market. And the second is the perceived ease of use. And that is also the challenge that we were talking about, designing those experiences, designing those digital solutions that perfectly fits with the needs. So actually, this is a really nice point to move to Dr. Veronica and tell us about the challenges that you have in Switzerland. I'm really I want to know how do you guys manage the challenges, if you have any challenges with the digital health transformation there in Switzerland?
Yeah, I mean, actually, even if I'm now in Switzerland, I wanted to add something in the question before that actually it's related with this one. Because I think it's, for example, with the mobile phone happened the same. And we were also told, I don't remember who mentioned before, right? And it was like the first mobile phone, it was not the iPhone that we can have now, for example, no, or whatever. But this has changed. And actually I remember, and it was a film that has shown for first time the iPhone 3. And the people that was having it was like, I don't know how it works, like just throwing away, right? So I mean, sometimes it's like, it's not about when the technology should be adapted by the social, by the society, but it's also the wave that it's coming with the society. Because, for example, we were saying, okay, if internet is slow, we are not going to take this and adapt it and use it, right? So we need everything. I mean, it's not only the technology that we have available, because, I mean, I don't want to say the name, also because I don't remember, but there were some technologies that were very, very, very in a high level many years ago, but nobody had the knowledge, the experience. Nobody heard before something similar. So actually it fell. Now, if you maybe show this, it's like, wow, unbelievable. And actually some things similar I was sharing with some colleagues some weeks ago, and they were like, wow, it's very expensive, or it's cheap, or how can I have it? And I was like, it fell. And they were like, why not? It's impossible. It's super, like, nice to have in, for example, in some clinics, because it was related with quantitative assessments. And actually, for example, during before my PhD, I was also using the Kinect, for example, for tracking and having some analysis of the gait of the patients. And it was actually very already forward, right? So nobody actually took it. And now I receive from ResearchGate many messages like, what did you do in here and in that? And I was like, this is something published like, I don't know, 6 or 7 years ago. And nobody was interested at that time, right? So I think it also has to be with the way, because if you have the best idea, if you have the best technology, but nobody knows how to use it, it's not going to be successful, right? So I think it's
of course.
And also regarding before the other question, how to adapt it. I don't want to say anything regarding the government, first of all, because I don't know. So I don't want to say anything that it's ignorant from my side, but because I'm not super sure in Switzerland, and I'm not super sure in Spain because I already left, right? So, but I think it's health, it's always hard. Let's say like that, right? Because it's not, it's not something that brings a lot of money. So sometimes it's not a priority, but I think it's also, they don't have the best perspective for that, because it's not what it gives you, it's what can save the country. Because if you don't invert and invest in prevention, for example, you can save a lot of money then. Because I was saying, right, if you suffer a stroke, then the family, for example, the wife, imagine, has to stop working. Also, the daughter maybe cannot go to study to a university in the other city because they need her to bring the... I mean, it's more than that. So all of these costs are the cost of the government. So I think the government should have some, I mean, I don't know which government, whichever. I mean, it doesn't make the importance here. It's just, okay, just to be, has some perspective, not in these 5 years, not even in 10 years, but see in 50, 100 years. I mean, you are going to save a lot of money. It's not going to give in another sectors, but it's the most important. I mean, if we are not healthy, what we are going to do if we have a country full of patients, right?
Yes, I mean, I believe that what you're sharing is completely right. And I believe in the interconnectivity of the responsibility, sharing the responsibility. It's not only the government's responsibility, to be honest, also the private sector, as Dr. Antonio mentioned before. I mean, I could see and I could monitor the investments ecosystem on the startups in the past couple of years. And I could see a lot of investments going to the mainstream food delivery apps, for instance, the transportation apps like Uber and other stuff. But there is, I mean, compared to these markets, the healthcare is getting the least, because most of the times it's still under development and under research and development, let's say. So, for example, everybody would say, okay, why should I invest in a technology that you guys are still trying? And you're still questioning the pain management levels, for instance, of that virtual reality experience, or the augmented reality, how it helps with the neuro rehabilitation, or how much in percentage it enhances the neuroplasticity, for instance, in your case. So I guess that's one part of it, that it's also a shared responsibility with other players in the market, not only the government. So yes, I completely agree with you. And maybe, I guess, Dr. Antonio also, he had a similar experience with trying to raise funds for their startup. So how hard it is to find some financing options and raising the funds for the digital health startups, Dr. Antonio?
Oh, it's very difficult because of that. Everybody wants to put money in something that is easier to understand. And I really think that have a lot of technologies that is easy, like telemedicine platforms, okay. But if you want to do something that it's very, very different than what we are using, it's difficult. But that's the only way to move on, to create something different, because we understand that we have to make another step. And we have nowadays in the world a lot of telemedicine platform, a lot of things that it's very good. I understand it's very valuable, but it's something that are competing with itself. What we think that need investment, it's this new technology. It's the create something very different, and that's very difficult to get money. So I think that the only way to do that is create some funds that can invest in something that it's I don't know, something that it's a possibility, just a possibility.
Yeah, thank you for saying that. And I guess that's the maybe the role of the commercial players, like Dr. Fedi, for instance. The pharmaceutical companies, they are actually, most of the times, they are the financing party, to the whole healthcare industry. And I could see actually in the past couple of years a very, very good movement from many multinational companies like Merck, for instance, of course, AstraZeneca, Roche, and other companies that are investing and creating more business accelerators or business incubators to invite those people coming from the healthcare sector, and they actually need some fundraising for their ideas. And I guess that's also a very good move that we should truly promote. I mean, putting the entrepreneurial part ahead of us with the innovation, the healthcare innovation. So that's really nice. And I'm not sure if Dr. Fadi or would like to comment maybe about this, the startup. I mean, how come do you at Merck, for instance, you support those kind of new innovations, whether it's coming from outside of the company or inside the company?
Well, actually, this is very interesting. Actually, because we are speaking here about entrepreneurship and the ideas. We tackle it from inside, from within the company, and even from outside. And regarding even speaking about the government, sometimes we succeeded to have some kind of consultancy regarding the digital, because some of the initiatives of the government regarding registry and regarding, of course, the campaigns that happened regarding regarding diabetes, regarding cardiovascular, that happened in the last couple of years, like the 100 million Saha in Arabic, which is a program. So actually also we succeeded to give good consultancy even from digital perspective and support to the government regarding this perspective. And also we tested some kind of entrepreneurs and some kind of startups, because this kind of link, if you find someone specifically during the times of the COVID, if you find that there is a solution that can support to speed up the process, why we reinvent the wheel from the beginning and start it from scratch? So of course, screening of the startups and taking it from outside and inside talents, this makes it easier and faster. And this is how even we had like this kind of close talk with the government interactions, so we can have this kind of consultancy to make the digital even boosted and supported by the government.
Well, thank you so much for these insights. Actually, the time is ticking. I'm really enjoying this discussion. Honestly speaking, I mean, I didn't expect that much of the information and back and forth. And I'm really happy that we're having this multinational gathering, and we will definitely do it again. But before we close the live, let me ask you, all the panelists, one question. Which kind of technology do you think the closest to the market, from your perspective, from your practices, in your area of work, in your field? So let's start with Dr. Fadi, for instance. Which technology do you prefer to see in the next couple of years, let's say, booming in Egypt?
Prefer to see, it's very clear. Of course, this it's between the augmented reality and the virtual reality taking a different place, because like 3 years from now, I already was in a conference in regarding the cardio, and I found that this is already implemented. And I wish to have this adopted in our markets, because it's really a transformation. It makes it even, you simulate whatever you want in a good way. Maybe we found it in a more economical pattern, like economy of scale, to make it easier to be reached to more segment of the patients and the physicians, but this is what I prefer to have. Yeah.
Well, thank you so much, and definitely we will have different discussions in the very near future, very specific webinars regarding these technologies, and we would love to have you again and again. So thank you, Dr. Fadi, for being today with us, and let me move to Dr. Antonio. Dr. Antonio, which digital technology do you truly wish to be, whether from the perspective of a cardiosurgeon or from the perspective of a Brazilian citizen that would love to see something implemented in Brazil? Which technology would you really love to see?
I think that the use of VR, AR, the mixed reality, this integration of this technology in the healthcare system, I really think that will be the very helpful. So that's what we want to see in the future, this integration of VR, AR, and mixed reality.
Well, that's really nice. Thank you so much. And also we have Dr. Rania. She mentioned something about the forecasting the new, or I guess she's talking about the predictive medicine, which is also part of the AI and machine learning. And we will definitely have this for later on discussions, Dr. Rania. So thank you for sharing that. Thanks, Dr. Antonio. And let's move to Dr. Veronica. Of course, I know that you are very into those technologies, but the augmented and the virtual reality. But anything else? I mean, any other technology that you would love to see in the future being implemented in the European market, for instance?
I mean, VR, AR, you already said it, right? And I did the thesis of that, so it has to work for something. But no, apart jokes, yeah, I mean, whatever that, for example, that we were seeing before, the iWatch, for example, I think it's very important to predict also for algorithm in order to prevent strokes, heart attacks. So yeah, I think it's yeah, or VR, AR, or I mean, for me it's at the same point, because one thing is for treating the ones that couldn't be prevented, right? So
yes, exactly. And that's one thing, one very good point to maybe end our webinar with, is that digital health, it has many perspectives and many layers. Not only the diagnostic part or helping with the diagnosis only, but also with the treatment, the intervention. Some of the AI solutions are being used for the predictive medicine, as we mentioned, the chat bots and the different apps that helps with the chatting with the patients and the preliminary diagnosis, we can say, and definitely the monitoring, for instance, the glucose monitoring devices, the heart rates, and the people, the chronic patients that really need monitoring with the wearable devices. So it can come in different shapes, it can come in different layers, the technologies, but at the end, it's about being patient-centric technologies that can fit with getting the patient's life to the best. So actually, I would love to thank everybody. I would like to thank everyone who attended the live session on Facebook, LinkedIn, or YouTube. And definitely keep signing up for the next webinars. We started, we're not going to stop. We will go forward with more specific topics like today. And I would definitely like to thank our panelists, Dr. Veronica, Dr. Fedi, Dr. Antonio, for being here with us today. It's really an honor, and I didn't expect that much of kind of interaction. I'm so excited to have you for later on discussions. And of course, let's not forget about our amazing host, Madeleine. Thank you, Madeleine, for making this happen. And definitely let's meet in other webinars. So thank you, everybody. See you.
thank you so much. The honor was ours.
Thank you, Dr. Veronica.
It's our honor.
Thank you, Dr. Fedi.
Thank you a lot. It's a very
Thanks, Dr.
very good
Antonio.
discussion. Thank you a lot.
Thank you. See you.